Most strokes don't begin with pain. They begin in silence, while the person is asleep and completely unaware their circulation is slowing in the wrong position. Right now, millions of adults over 60 are going to bed in a posture that quietly increases pressure on the heart, worsens nighttime oxygen drops, and may help dangerous blood clots form hour after hour. And the terrifying part is that the body often warns you long before the emergency comes. But almost nobody recognizes the signs. If you're serious about taking better care of your health, make sure you subscribe. I share simple, practical advice designed especially for seniors. And feel free to leave a comment telling me where you're watching from. I appreciate every one of you. Let's get back to it. Nobody talks about 3 a.m., not your physician, not the cardiologist who reviewed your last scan, not the evening news segment on heart health. Everyone focuses on what you do while you're awake, the food on your plate, the medications on your nightstand, the morning walk you either take or keep postponing. But there is one window of time, hours your doctor has almost certainly never asked you about. When the cardiovascular system of an adult over 60 becomes quietly, measurably vulnerable, and it happens while you're sleeping, while the room is dark, while the house is silent, while every person who loves you assumes you are safe because you are resting. Here is what most people believe about sleep. The heart is recovering. The body is repairing. Nothing dangerous can happen while I'm lying still with my eyes closed. But research published in the journal Circulation tells a different story. Stroke risk and sudden cardiac events peak during the early morning hours. Not during exertion, not during stress. During the hours surrounding sleep. The body is still. The danger is not. Because while you lie motionless for 7 or 8 hours, your blood pressure shifts dramatically. Circulation slows. Fluid that accumulated in your legs throughout the day begins moving upward toward the chest. Breathing patterns change in ways most people never notice. And your heart, which has no off switch, works through all of it, in a position it never chose. For adults over 60, this matters more than most people are ever told. Because the cardiovascular system at 65 is not the same system it was at 45. Blood vessels gradually lose elasticity. The arterial lining becomes less efficient at regulating flow. Nitric oxide production, the compound responsible for keeping arteries relaxed and open, declines measurably with age. Gravity begins winning, and for 6 to 8 hours every night, it pulls against circulation that is already working harder than it should. The warning signs are easy to miss, or dismiss. Feet that are swollen before breakfast. Legs that feel heavy and dense after waking. Nighttime palpitations that come and go. Exhaustion that 7 hours of sleep doesn't fix. More bathroom trips at 2 a.m. than you can explain. Most people do exactly what I would have done myself. They call it aging. They mention it once to their doctor, get told the numbers are acceptable, and go home. They lie down in exactly the same position they always have. My name is Dr. James Cross. For nearly 2 decades, I have worked with older adults dealing with cardiovascular disease, blood pressure instability, circulation disorders, and stroke recovery. And over those years, I started noticing a pattern in my patients that I could no longer explain away. A pattern that kept pointing to the same place. The bedroom. Specifically, what was happening in those silent hours that nobody was watching. And what I found genuinely changed how I think about cardiovascular health after 60. Gravity. That one word is where this conversation has to begin. Because when most people think about what threatens their heart, they think about cholesterol, stress, family history, sedentary habits. Nobody thinks about gravity. But after 60, gravity becomes one of the most consistent forces working against your circulation. And nowhere does it matter more than during the hours you spend lying down. Here is what changes inside the aging cardiovascular system that most physicians never find time to explain in a 15-minute appointment. Your veins have a job that most people underestimate. They don't just carry blood, they push it upward from your feet, your calves, your thighs, all the way back up to your heart against gravity, every minute of every day. At 35, the vein walls have enough muscular tone and elasticity to do that job efficiently. At 65, that efficiency has quietly declined. Studies published in the Journal of the American College of Cardiology have shown that vascular stiffness increases progressively with age, reducing the cardiovascular system's ability to adapt to pressure changes, including the pressure shifts that happen every single night during sleep. And then there is the endothelium. The endothelium is the thin inner lining of your blood vessels. It is responsible for releasing nitric oxide, a compound that signals arteries to relax, dilate, and maintain smooth, healthy blood flow. After 60, nitric oxide production drops significantly. What that means practically is this: arteries that once opened easily under mild demand now respond more slowly, less fully, and with more effort. Blood moves differently. Pressure builds differently. And when circulation slows, as it always does during sleep, the risk of blood pooling in the lower extremities increases in ways that simply did not exist when you were younger. This is one reason deep vein thrombosis, dangerous clotting in the leg veins, becomes substantially more common after age 60. The CDC estimates that blood clots affect between 300,000 and 600,000 Americans every year, with risk rising sharply in older adults. And yet, most people never connect that risk to the hours they spend lying still. They connect it to flights, to hospitals, to surgery, not to their own mattress. Now, add one more layer that makes everything worse. During the day, fluid gradually pools in the lower legs due to gravity and reduced venous return. By evening, many adults over 60 are carrying measurable excess fluid in their ankles and calves without realizing it. When they lie flat at night, that fluid doesn't stay in the legs. It redistributes upward, toward the chest, the airway, the spaces surrounding the heart. And that redistribution, happening silently while you sleep, can contribute to nighttime breathlessness, elevated blood pressure, disrupted sleep, and unexplained fatigue the following morning. Most people blame a bad night's sleep, but the body was responding to something mechanical, something happening every night, something that changes significantly depending on one variable almost nobody considers: the position the body holds while it sleeps. So now the question becomes unavoidable. If the aging cardiovascular system is already working harder, if veins are less efficient, arteries are stiffer, and fluid is redistributing toward the chest every single night, then what happens when the position the body rests in makes all of that worse? The answer is something most people have never once considered, because for the majority of adults over 60, sleep position was chosen decades ago, not by a cardiologist, not by anyone with knowledge of vascular mechanics. It was chosen by habit, by comfort, by whatever felt natural at 28 years old and simply never changed. And the body has been paying that bill quietly ever since. Let's start with the most common position in older adults: flat on the back. It feels logical, it feels neutral, it feels like the body is evenly supported with no pressure favoring one side. But for adults over 60 with any degree of vascular change, flat back sleeping carries a consequence most people never see coming. When the body lies completely flat and supine, the tongue and soft tissues of the throat relax backward under gravity. In younger adults with strong airway muscle tone, this causes minimal disruption. In older adults, it can partially, sometimes significantly, obstruct the airway. The result is sleep apnea. And sleep apnea is not simply loud snoring. Research published in the Journal of the American Heart Association has established a direct link between untreated sleep apnea and increased risk of hypertension, atrial fibrillation, stroke, and heart failure. Every apnea episode drops oxygen levels in the blood. Every oxygen drop triggers a stress response. The heart rate surges. Blood pressure spikes. And this can happen dozens of times per night, without the person ever fully waking, without them ever knowing. They wake in the morning feeling unrested, foggy, and heavy, and assume they simply slept poorly. But the cardiovascular system absorbed hours of repeated stress while they lay completely unaware. Now, consider stomach sleeping. This position compresses the chest cavity directly. It forces the neck into sustained rotation for hours at a time. It restricts the natural expansion of the lungs and places mechanical pressure on the diaphragm, the primary muscle responsible for breathing. For an older adult with any degree of cardiovascular compromise, restricted breathing during sleep is not a minor inconvenience. It is a nightly tax on the heart. Then there is right side sleeping. This one is less discussed, and the science here is more nuanced. So, I want to be careful not to overstate it. But anatomically, several cardiovascular structures are positioned in ways that may be affected by sustained pressure on the right side of the body. Some patients with heart failure report increased discomfort when sleeping on their right side. Some research suggests right side sleeping may place different mechanical demands on the inferior vena cava, the large vein responsible for returning blood from the lower body to the heart. It is not a dramatic effect for everyone, but for someone whose circulation is already compromised by age and vascular stiffness, hours spent in a position that adds even modest additional resistance to venous return is not a neutral choice. I had a patient, a 71-year-old retired civil engineer named Henry, meticulous man, monitored his blood pressure twice daily, took his medications without fail, walked 30 minutes every morning regardless of weather, and yet every night he woke between 2 and 3 a.m. with his heart pounding and his chest feeling strangely dense. Cardiac workup after cardiac workup returned unremarkable results. When I finally asked him to describe exactly how he slept, position, pillow height, body angle, the picture began to change. Henry had slept flat on his back his entire adult life, and he snored heavily enough that his wife had moved to a separate room 11 years earlier. That detail alone told me something important. Within 6 weeks of changing his sleep position and angle, Henry's nighttime awakenings had reduced dramatically. His morning blood pressure readings were more consistent, and for the first time in years, he described waking feeling like sleep had actually done something for him, not magic, mechanics. And that brings us to the position that kept appearing among my patients who were quietly improving, the one I could no longer ignore. I want to be honest with you about something. When I first started connecting these dots, I resisted the conclusion because it felt too simple. In medicine, we are trained to look for complex answers to complex problems. We investigate, we order tests, we adjust medications, we refer to specialists, we build treatment plans with multiple moving parts. The idea that something as basic as which side of the body a person sleeps on could meaningfully influence cardiovascular strain, it felt almost too straightforward to take seriously. But the pattern kept appearing, patient after patient, year after year. And at some point, the evidence in front of me became impossible to keep dismissing. Here is what I began noticing across a significant number of my older patients who were quietly improving. Not dramatically, not overnight, but steadily and consistently, without any major change to their medications or lifestyle. They were sleeping on their left side. Not all of them had made that choice deliberately. Several had shifted there naturally due to discomfort in other positions. A few had done it on the advice of a physical therapist treating an unrelated issue. One patient, a 69-year-old woman named Ruth, told me she had started sleeping that way simply because her bedroom furniture had been rearranged. She had no idea it was affecting her heart, but her nighttime palpitations had decreased. Her morning ankle swelling was noticeably reduced. She was waking less frequently during the night, and her early morning blood pressure readings, historically her most unstable, had become more consistent over a period of several weeks. Now, here is the anatomy that makes this more than coincidence. The heart sits slightly left of center in the chest cavity. When the body lies on the left side, the heart is not being compressed against surrounding structures in the same way it can be under other positional pressures. Beyond that, the thoracic duct, the body's primary lymphatic drainage channel, responsible for returning fluid and metabolic waste from the lower body back into circulation, empties predominantly on the left side of the chest near the subclavian vein. Left side positioning appears to support that drainage pathway rather than work against it. Additionally, research involving patients with congestive heart failure, published in the American Journal of Cardiology, has shown that body position during sleep measurably influences autonomic nervous system activity, the system that regulates heart rate, blood pressure, and vascular tone during rest. Position is not passive. It is an active cardiovascular variable operating every single night. Now, I want to be direct with you because I have no interest in overpromising. Left side sleeping is not a cure. It does not replace medication. It does not reverse arterial disease or eliminate stroke risk on its own. But as a mechanical adjustment, one that costs nothing, requires no prescription, and takes effect at the moment you close your eyes, it may be one of the most underutilized tools available to adults over 60. And it is only the first part of what I want to show you. Because position alone is not the complete picture. There is something else. Something most people get dangerously wrong every single night without realizing it. And it has everything to do with angle. Angle. That single word is what separates people who sleep correctly for their cardiovascular system from people who think they are, but aren't. Because here is what happens in almost every bedroom across the country. An older adult hears that elevating during sleep is beneficial. Maybe their doctor mentioned it casually. Maybe they read it somewhere. So they do what feels logical. They stack pillows. 2 pillows, sometimes 3, occasionally 4. And they go to sleep believing they have solved the problem. They haven't. Here is what stacked pillows actually do to the body. They push the head forward and tilt the chin downward toward the chest. The neck bends. The cervical spine curves unnaturally. And the torso, the chest, the heart, the lungs, remains completely flat against the mattress. So, the head is elevated, but the cardiovascular system is not. The very structures that need positional support, the heart, the major vessels, the lungs, are still lying at the same flat angle they always were. And the neck is now under sustained mechanical strain for 7 hours on top of everything else. This distinction matters enormously, and almost nobody makes it. What the cardiovascular system actually benefits from is gentle upper body elevation, meaning the torso rises, not just the head. The chest, the shoulders, the upper abdomen, all inclined at a gradual upward angle. Research on nocturnal blood pressure patterns has shown that upper body elevation of approximately 15 to 20 degrees can support healthier nighttime blood pressure regulation. A study published in the Journal of Human Hypertension found that sleeping position and body angle measurably influenced nocturnal blood pressure dipping, the natural overnight drop in blood pressure that protects the cardiovascular system during sleep. When that dipping pattern is disrupted, which flat sleeping in older adults frequently does, the heart absorbs hours of unnecessary pressure that compounds night after night. Gentle torso elevation helps restore that pattern, and there is a second reason elevation matters that most people never anticipate. The vagus nerve. The vagus nerve runs from the brainstem through the chest and into the abdomen. It regulates heart rate, digestion, and the body's parasympathetic, rest and recovery, response. The esophagus runs directly alongside it. When an older adult sleeps completely flat after an evening meal, stomach acid can move upward into the esophagus, a condition most people recognize simply as nighttime reflux. But what most people do not realize is that esophageal irritation can stimulate the vagus nerve directly, triggering sensations that feel alarmingly cardiac. Racing heart, chest tightness, sudden waking with a surge of anxiety that feels indistinguishable from a cardiac event. I had a patient named Arthur, 68 years old, retired secondary school teacher, came to me convinced something was seriously wrong with his heart because he woke in a panic at 3 a.m. several nights every week, chest pounding, certain he was in danger. 3 separate cardiac evaluations found nothing structurally wrong. What we found instead was that Arthur ate his largest meal of the day at 8 p.m. and went to bed completely flat less than 2 hours later. Once he shifted to a gentle upper body incline, using a proper wedge support rather than stacked pillows, and adjusted his evening eating window, those nighttime episodes reduced to almost nothing within a month. His heart had not been the problem, his angle had. Now the tool that makes genuine torso elevation possible is a wedge pillow, a firm, gradually inclined support that lifts the entire upper body as one continuous unit rather than bending the neck forward in isolation. It is not expensive, it is not complicated, it does not require a prescription or a specialist referral. It requires understanding why flat is not neutral for an aging cardiovascular system, and understanding that position and angle together form the foundation of what I now consider a complete nighttime heart support approach. But there is still one more piece, one that almost no one discusses, one that I rarely hear raised in clinical settings, and one that, once you understand it, will completely change how you think about the hours before you go to bed. Here is something that will change how you look at your own legs tonight. Right now, as you are reading or watching this, fluid is pooling in your lower extremities. Not because something is wrong with you specifically, not because of a diagnosis or a deficiency, because of gravity. Every hour spent upright, sitting, standing, walking, pulls fluid downward into the tissues of the lower legs and ankles. The venous system works continuously to push that fluid back upward toward the heart. But as we established, after 60, that return system is operating at reduced efficiency. So, fluid accumulates, slowly, quietly, across the entire day. By evening, many adults over 60 are carrying a measurable volume of excess fluid in their lower extremities, without any awareness that it is there. The ankles may look mildly puffy, the calves may feel dense or heavy. The shoes that fit comfortably in the morning feel slightly tighter by late afternoon. Most people notice these things and think nothing significant of them. But here is where it becomes a cardiovascular issue. When the body finally lies down at night, gravity's direction changes entirely. That fluid, everything that spent the entire day pooling downward, now has a clear, unobstructed path toward the upper body. And it moves. Within the first 1 to 2 hours of lying flat, a significant volume of fluid redistributes from the legs toward the chest, the airway, and the spaces surrounding the lungs and heart. Research published in the American Journal of Respiratory and Critical Care Medicine has shown that this overnight fluid shift can measurably increase airway resistance, narrowing the passages through which air moves during sleep. In older adults already predisposed to sleep-disordered breathing, this redistribution can worsen nighttime oxygen levels significantly. Beyond the airway, fluid shifting toward the chest increases the workload on the heart during the very hours it needs the least resistance. The consequences are recognizable if you know what to look for. Waking frequently to urinate, the kidneys processing redistributed fluid, nighttime breathlessness, or a sensation of chest heaviness, poor sleep quality without obvious explanation, morning fatigue that feels disproportionate to how long you actually slept. The body is not failing randomly. It is responding to a mechanical event happening every single night. And the intervention, when I first encountered it in vascular medicine literature, struck me as almost frustratingly simple. Elevate the legs before bed. Not all night. Not with permanent elevation devices or complicated equipment. Simply 10 to 15 minutes of leg elevation before lying down, feet raised above the level of the heart, allows gravity to assist the return of accumulated fluid back into central circulation before sleep begins. The body processes it more efficiently while still awake and upright. The overnight redistribution toward the chest is reduced. The airway faces less resistance. The heart begins the night with a lighter load. A study in the Journal of Vascular Surgery found that pre-sleep leg elevation in patients with chronic venous insufficiency significantly reduced overnight fluid accumulation and improved sleep-related symptoms. Simple, inexpensive, requiring nothing more than a pillow beneath the calves for 15 minutes before bed. Yet almost no one does it, and almost no one is told to. Now we have 3 pieces on the table, left side sleeping. Gentle upper body elevation, pre-sleep fluid drainage, each one meaningful individually, but together, as a deliberate nightly routine, they form something worth understanding completely. 3 pieces, left side sleeping, gentle upper body elevation, pre-sleep leg drainage. Individually, each addresses a specific mechanical vulnerability in the aging cardiovascular system. Together, executed consistently, night after night, they create something no single adjustment could achieve alone. A sleeping environment that works with the body instead of quietly against it. Let me walk you through exactly how this looks in practice. The foundation is position. Begin on your left side, not curled tightly into a fetal shape that compresses the abdomen and restricts diaphragm movement. Simply lying comfortably on the left side, body in a relaxed, relatively straight alignment. If staying on one side feels difficult initially, that is completely normal. Years of habitual sleeping patterns do not change in a single night. The goal in the first week is simply awareness, noticing which position you drift into, and gently returning to the left side without frustration. Consistency over perfection. Always. The second layer is elevation. A wedge pillow, firm, gradually inclined, supporting the body from the mid-back upward, provides the torso elevation that stacked pillows cannot. The target angle is approximately 15 to 20 degrees, enough to allow gravity to assist circulation. Not so steep that the body slides downward or strains the lower back. A pillow positioned between the knees while side sleeping keeps the hips stacked neutrally, preventing the upper leg from rotating forward and pulling the spine into misalignment. Sustained spinal tension during sleep has a measurable effect on nocturnal blood pressure. Small detail, meaningful consequence. The third layer happens before you get into bed. 10 to 15 minutes of leg elevation. A firm pillow beneath the calves works perfectly. During those minutes, gravity assists venous return. Accumulated fluid moves back into central circulation before sleep begins. The heart starts the night with a lighter load. Research in sleep medicine has confirmed that consistent pre-sleep routines measurably improve overnight cardiovascular stability in older adults. Routine itself becomes medicine. None of this transforms cardiovascular health in a single night, but the body responds to conditions. Change those conditions consistently, and even at 70, even at 78, the body begins responding. And that brings us to the most important thing I want to leave you with. I want to say something that medicine does not say often enough. Getting older does not mean the body has stopped listening. It means the conditions matter more than they ever did before. So many adults over 60 have quietly accepted the exhaustion, the swelling, the restless nights, the mornings that never feel fully restorative. They have filed these things under aging and moved on because nobody told them there was anything else to consider. But sometimes the body is not declining. Sometimes it is simply responding to conditions that have been working against it every single night for years. Change the conditions, and the body responds. Not perfectly, not instantly, not dramatically in the first week, but meaningfully. Less swelling by morning, fewer awakenings in the night, blood pressure that behaves more predictably, sleep that finally feels like it accomplished something for the heart rather than quietly burdening it. Tonight, before you lie down, I want you to pay attention to something you have probably never thought to notice. How does your body feel in those first few minutes after you get into bed? Where is the heaviness? Where is the pressure? How is your breathing? Because that moment, quiet, unremarkable, happening every single night, is a cardiovascular event. And you now know something most people never will. You know it matters. You know why it matters. And you know what to do about it. Take care of your heart tonight, because it has never once stopped taking care of you. Thanks for watching all the way through. Staying informed is key to living a healthier, longer life. If you want more simple, practical health advice, make sure you subscribe and tap the next video on your screen. And before you go, leave a comment and rate this from 1 to 10. Your feedback helps me create better guidance for you.